Welcome back. We have another segment that takes care of the city of Long Beach, the whole city, whatever age, whatever stage you're in. We have what's called the Children's Clinic, which has extended itself so much that I can't even remember to tell you all of them places. But Dr. Elisa Nicholas is here. She is the executive director. And then we also have Mike Van Dyke, who is president of the board. And I'm delighted both of you are here today. The work that you do, I don't think is really recognized as, or the clinic does, with you heading it, really is known by the community and what it provides for the community without having millions of dollars when you talk about going any place when you're sick. So I want you to tell us about this. Tell us, let's start with about how many children do you see or people do you see?
So we actually see children, adolescents, adults, and seniors. So we see all ages now. And half of our patients that we see are adults now, which
so
is...
it isn't Children's Clinic anymore.
It's the Children's Clinic serving children and their families. And you know, we
okay.
may do a name change,
Okay.
TCC Family Health Centers or something in the near future. But we are we were founded in 1939 as the Children's Clinic, and for many years, and when I first came, we saw only children.
That's what I thought.
But then the parents would come in, and they needed health care, and you can't care for your children if you're not healthy. So we worked with the board and got them to expand our mission, and we did that.
And how
so
long
we've
ago
grown.
was that?
Oh, probably 15
Years
maybe
ago.
20 years ago.
Okay.
So, and with that came the opportunity to access increased funding from the federal government and really be creative and serve the entire community. So that's been a great pleasure. So we have 40,000 patients every year that we see. So we probably have more like 50,000 because not everybody comes in every year. And they're all low income. About half are children now, so that's about 20,000 children. The rest are adults. We have 11 sites and 1 mobile health center. We have a mobile van.
Now, 11 sites.
11 sites.
Your major site is?
Is at the largest site is on the campus of Long Beach Memorial Medical Center, but we're freestanding, we're a separate 501c3.
It's way in buildings in the back of the hospital.
Yes, it's in the Buffums building across from the emergency room, and that is a 32-room clinic. It's a very large clinic. We have 2 pods for pediatrics and 1 for adults.
And then the other location?
And the other locations, we own a building on 1057 Pine Avenue. That's an 8-room clinic that serves the entire community in 90813. We have a site in Bellflower right over the border and 1 on Pacific Avenue. Those were the previous Universal Care clinics that we took over. We now are at Westside. The Westside Neighborhood Clinic joined us, and we hired all their employees, and they're very happy, and we're really respecting the founders of that clinic and carrying on their mission, and their board president has joined our board, Dr. Eden Yorga. We have 4 clinics at schools. The first one was International. That's a very small clinic, and that serves only children, but the other ones serve the entire community. It's a clinic, a full clinic, 5 days a week for children and adults and people in the community. So that's at Hamilton Middle School. That's an 8-room clinic with a family resource center.
My goodness. We'll never remember them all, but you are in all areas of the city.
Yes, yes. The one area we're not is, down the Anaheim corridor, but we're looking at putting a site there. And then we're at the multi-service center. So we have a whole new focus on homeless. We have a whole new focus on trauma-informed care and trauma-facing children and families and how that affects their health and well-being. And we're working a lot with domestic violence victims, and we have a medical legal partnership with LAFLA, LA Legal Aid Foundation, where we have a lawyer that just works with our families to address the issues that affect their health. So we're really trying to go upstream, address those issues, and then provide the best quality outpatient health care to our families. We're now a patient-centered medical home. That's a national certification. That's very hard to get. We got that certification.
Well, this is a whole new interview from last time.
Yeah.
Because, and I think you were here probably 4 years ago, 3 or 4 years ago.
Probably more like 6, or 8,
Well,
you know,
but
time
but
flies.
yeah, but anyway, since
Yes.
that time,
Yes.
it's extended. And what have you had to do with all this work?
Oh,
Mike?
shoot, I've been involved with the clinic for about 20 years now, starting off as a volunteer, then I was on their advisory board, and then came onto their board probably about 6 years ago, and then kind of moved into the leadership role here. But my family, both my parents were pediatricians, and they volunteered for the clinic, so it, you know, it's in the family, and my kids have helped out as well,
Now,
volunteering for.
if they volunteer, did they volunteer in their profession?
No, well,
Or in the guidance of it?
Well, they're down like for the fundraising for the
I
beach
see.
walk and such. They'll
I
come
see.
down and help out. My daughter's interested in medicine, has done a tour of the clinic, hasn't helped out in that fashion, but hopefully when they're a little
And
bit
what does the
older.
board do?
Excuse me?
What does the board do?
Well, what the board does is, you know, part of the regulatory environment, the board takes an active role in making sure that the
We
the,
require-
that
meet the
the clinic
requirements.
is following the, you know, the regulations that are set forth by the regulatory bodies. So a lot of oversight. Then at the same time, we're encouraging the Dr. Nicholas and the clinic to, you know, look further and see how we can serve the community. I think what Dr. Nicholas, the one piece that she did miss is we are seeing the expecting mothers, the OBGYN piece of it.
Oh
So
my.
we've taken that
Yes,
on
I
as
forgot
well.
that.
So not only are we providing health care for the children and then also the families, you know, that are with the children, but also the expecting mothers, hopefully giving them a.
Now, if somebody who does not have the access to funds, what do they do?
You know, we will take people even if they don't have the ability to pay. And what we do is we screen them and we see if they can fit into any programs that we have. We have special programs with the county that only we have in the community for people that cannot access other health insurance. So really we try, no one is turned away
They're
because
not
of inability
insurance,
to pay.
but need.
So if they're low income, very low income, we can usually fit them into a program. If they don't fit in, then we put them on sliding fee scale, and we ask them to pay as much as they're able, and we can make that, you know, over time. But nobody should feel that they don't have a place to go, especially children. We have a lot of capacity for children and adults, and we're always trying to hire more physicians to work with us so we can serve more people.
And are these volunteer physicians or they're paid?
They're paid. And
Yeah.
you know, when I first started, we had mostly volunteer. But we're on electronic health records now. We want that continuity of care. And the volunteer physician pool was diminishing. So really, they are our employees. We have over 300 employees at the Children's Clinic. So we're now a big economic engine in the community also. I mean, our budget is $30 million. And so I think we're one of the largest Long Beach-based nonprofits, other than the hospitals and the universities and
Oh,
colleges.
I'm sure.
Because we do serve Long Beach and one part of Bellflower, but people come from the South Bay, but the majority of our patients are from Long Beach.
Oh my, I didn't realize it'd grown that much.
Yes.
That's amazing.
Well, Beverly, you know, the population of Long Beach being at around 450,000, if we're seeing 45,000, that's about 10% of the population
Wow.
that calls the clinic their medical home.
Oh my goodness, is
So-
that
And a
right?
significant percentage of those that are low income. And we have special programs in asthma, we have special programs for childhood obesity, we have special programs, we identify the trauma and risks that our families have and try to intervene. We've grown our behavioral health department, we have social workers that will do therapy and refer to our sister and brother agencies that do specialized mental health services. We work with the Trauma Recovery Center, with For the Child, the Guidance Center, Mental Health America, we're on a grant with them, and Pacific Asian
I
Counseling
think you've
Services.
covered everything.
And we work with
know.
the health department, hand in hand.
Well, you know, I can't remember exactly what we talked about in the first one, because I don't remember it was children in that location. But, and people won't remember exactly where these places are, but you've given me the whole city as far as locations where they could find you. how do they find you otherwise? I mean,
It's really word of mouth. We don't do a lot of advertising to the client group, but half of our board is consumers, people that use our services. So half of our board of directors are people from the community that we serve, so they get the word out. The school district, knows
Yes.
we're there. The hospitals refer to us. We were doing emergency room diversion for a while for the hospital, which was very successful. So
you
they
go
know
into
that
the
they're-
schools and tell them?
We
what
do.
what-
We tried it. We outreach to the schools. We're at back to school night. The school nurses, I meet with them every year.
Very good.
Yes, and they know us, and we just finished our strategic planning, and we got their input and heard what they want us to do. I meet every 6 months to a year with Superintendent of Schools, Chris Steinhauser, and we just catch each other up. We work with Tiffany Brown. Our trauma work with the city, we've educated thousands of people in what it means to be a trauma-informed organization. We were the first in LA County to be certified.
So like if a homeowners association or a local group that meets would like to find out more about you, you can provide them with the information or
yes.
have somebody to come and talk to them.
Yes, and we have a website, thechildren'sclinic.org, no apostrophes, and that has the information. And we're more than happy to talk to any group and tell them about what we do. I think many people don't realize how much we do in this community.
Oh, well, I mean, I'm learning today, and I thought I knew a lot.
Yeah.
But actually, the growth, and of course the need has been there, but the growth that you've been to meet these needs is phenomenal.
And I think the new thing, other than the OB, is just the work with the homeless. So we're out in the field with Mental Health America, going out in the field, reaching out to people that are sick with wounds and severe chronic diseases, that we actually had have amazing staff that really joined us to work with the homeless. I mean, really wonderful. And then we are at the Multi-Service Center. We're the medical provider in the continuum of care. Other than the health department, they do STDs, HIV, TB. We do the chronic care and the acute care for the homeless. And then at Century Villages of Cabrillo, they built us a clinic. And we actually have a clinic on site at Century
that's
Villages
wonderful.
of Cabrillo. And now we have the mobile clinic that is at Union and at Long Beach Rescue Mission and at Christian Outreach and Action. We're there 2 days a week with a mobile van, with an exam room and a nurse practitioner or physician
goodness.
on that van.
Our time is up.
Oh.
I can't believe it, but there's been so much information that you've given us, and I think that if anybody needed any help in finding you, they could ask at school or at church,
Yes.
or probably where they would know about you, because to take care of 1/10 of the children in the city of Long Beach is a big job, and then they're adults now too. So
And it's our pleasure to work
Well,
here. We really are so
I love
honored
it.
to be in this
I
city.
just love it. I just loved having you here, and both of you. Mike,
Thank you.
thanks for your help, and Lisa.
And thank you
Oh,
for all
yeah,
you do for
yeah.
this city, and you have
Well,
done. We love
well,
you.
I love this place, and I love you guys. Thanks a
you.
lot.
Thank you
Thank you,
so
Mayor
much.
Woodley.
Thanks for watching. Wasn't this a good day? Thank you.